Jock itch or tinea cruris is a common fungal infection of the skin folds around the groin area, which is usually treated by keeping the area dry, as friction-free as possible, and antifungals. However, if your jock itch does not appear to have gotten a message and seems to be persisting, you may be experiencing one of many different conditions which affect the groin folds, which are not fungus. That means that there are several different skin conditions that can cause redness, can cause flakiness, can cause itch, can cause burning and pain, like jock itch can do, but are not jock itch. If you're one of those people, then you're in luck. In this episode, we'll delve into all things that look like jock itch, but are not jock itch. First, let's talk about the groin area. So the groin area is part of a family of areas of the skin that are called the intertriginous zones. Those are the skin folds. That includes the groin, includes the skin under the armpits, include the skin around the gluteal cleft, otherwise called as the butt crack, graphic, I know. And some people include the areas under the breasts, and in certain cases, the web spaces between the toes. Now these areas mostly have one thing in common, and that is skin-on-skin contact, so that's a built-in feature of those areas. There's friction involved with those areas. Also, many of these areas possess a high concentration of different glands, sweat glands and other types of glands, which amount to creating a lot of secretion and residue. With a combination of physical friction of skin on skin, moistness, dampness, and warmth, that creates several features that are inherent to those areas. First of all, there is a potential for physical friction and physical irritation. Second, a potential for chemical irritation by virtue of the secretions and whatever gets trapped under those areas that doesn't just flow off the skin. And the other thing is that creates a potential for overgrowth of microbial life, like bacteria and fungi. Now that seems like a disaster in the making. However, with most people, the intertriginous areas live in peace for the entire duration of their lives. However, certain people who are either genetically predisposed to developing issues over those areas, or people who are overweight, or people who have conditions that affect their immune function, such as diabetes, in those people, conditions affecting the intertriginous areas are more common. Inflammatory and infectious conditions affecting the intertriginous areas are all categorized under one big block called Intertrigo. Intertrigo basically means irritation of the skin folds. However, each condition is caused by a different type of factor or set of factors, and that requires a nuanced approach to bring relief to the patient and get resolution of the condition. So let's review some of those conditions that could cause intertrigo. First off, irritant intertrigo. Irritant intertrigo can be caused by irritants that come in contact with the skin of the intertriginous areas. Those include physical abrasives, such as very tight underwear, physical abrasives such as all sorts of cleansing supplies and practices, sponges, loofahs, washcloths, and whatnot. Other things that can lead to chafing and friction are physical activity, especially if you're going through a tremendous and unusual bout of physical activity. And then there are the chemical irritants. First of all, the normal secretions of the area can actually irritate the area itself under some circumstances. And then there are skincare products that can be applied to the area to lead to chemical irritation. Also, temperature application to the area can lead to irritation of the area, specifically hot water or all sorts of heating devices that people have been known to apply to the area. So that can lead to redness, flakiness, itch, sometimes burning, and pain. That can look a whole lot like jock itch, but is certainly not jock itch, as this is not an infectious entity. This is an irritant condition of the area. Another close cousin of irritant intertrigo is allergic contact intertrigo. This involves application of certain compounds to which the patient is allergic, meaning the immune system recognizes these molecules as something that's undesired and launches an attack to inflame the area. That again, much like irritant intertrigo, can appear as redness, flakiness, and be associated with the symptoms that we mentioned previously. Psoriasis is a chronic inflammatory condition that is considered an autoimmune condition. It can affect any area of the body. However, it is known to home in on the intertriginous zones, causing inverse psoriasis that again can look a whole lot like the previous conditions that we've mentioned and can look sometimes like jock itch. Seborrheic dermatitis is a close cousin of dandruff. It's an inflamed form of dandruff, usually affecting the scalp and the face. However, in certain more widespread cases, Seborrheic dermatitis can affect the intertriginous areas. It can appear as reddish or salmon-colored areas that are also scaly and can be associated with the same symptoms that we've described up until now. Erythrasma is a superficial bacterial infection of the skin that affects skin folds by default. It can affect the armpits, it can affect the groin area, and it can affect the web spaces between the toes. This condition can look very similar to ringworm or jock itch of the groin and is also associated with increased moisture over the area. Bacterial overgrowth over the intertriginous areas appears under certain conditions, especially if the person's overweight. That could be a risk for that. Other conditions that are prone to developing bacterial overgrowth, not an infection, just colonization of the area with abnormal bacteria. People with diabetes, for instance, and other immune-compromising conditions. Now, bacterial overgrowth by itself is not an issue. However, in certain cases, certain types of bacteria, when they overgrow in abundant numbers, they can change the function of the skin and make it more irritable or more sensitive, more prone to irritation. And in those cases, we can get a form of irritant Intertrigo that is associated with that microbial overgrowth. And finally, Candidiasis. Candidiasis is a skin infection which is caused by Candida, which is a category of yeast that grow on the skin and can infect the skin, causing significant redness, swelling, pustules at times, and the symptoms that we've described. Candidiasis has a special feature to it when it appears on the skin, and that is satellite lesions, meaning there's a main red area, and then around it are studded little circles or little patches of redness that can look a whole lot like the main event, but are surrounding it and separated from the main area of infection. If you found this video helpful, please hit the like and subscribe button. Also post in the comments section what condition you think you're experiencing or a loved one is experiencing that would be different from jock itch and could fall under one of these categories or maybe something different. Now let's get on with the video. So what should you avoid when you have any one of these conditions? There are categorical things to avoid. First of all, do not make matters worse for yourself. Avoid practices that could irritate the area. Specifically, avoid hot water, avoid strong streams of water in an attempt to cleanse the area, avoid physical friction such as scrubbing, sponging. Also try to loosen the underwear if you can. So avoid tight underwear when you have anything that's irritating the area, the intertriginous zones, and avoid chemical irritants such as detergents and cleansers to the best of your ability. If you must use a cleanser or soap, pick a very gentle one that's going to do the least amount of damage. Also avoid disinfecting the area with things such as alcohol, rubbing alcohol, or hydrogen peroxide. These two can seem like a good idea, but what they primarily will do is disrupt the integrity of the skin that is already suffering, is already on edge or beyond the edge, and that could lead to worsening of your symptoms and possibly opening up the door for an infection if you're not already experiencing one already. Also avoid applying things gratuitously, such as antifungals or antibiotics or any other topical in an attempt to relieve your symptoms if you're not absolutely 100% sure that you know what it is that you're treating. Those topical products are not innocuous. They can actually lead to irritant intertrigo or allergic contact intertrigo in susceptible individuals. Most intertrigos respond fairly quickly to the correct treatment, within a couple weeks usually. So if you've decided to go at it alone, not consult a dermatologist, can't consult a dermatologist, or for whatever reason you cannot see one, do not go on beyond 2 weeks and certainly stop the treatment if matters are getting worse. Finally, one very important tip you should exercise before seeing your dermatologist: do not wash the area the night before your appointment or the morning of, as the microbes that cause some of the conditions that we mentioned reside on the surface of the skin and are easily demonstrable in the clinic by certain techniques. When you wash these areas before showing up to your dermatology appointment, you're actually decreasing the number of microbes on the surface of the skin. You're not really helping the condition deeper down. But what you are doing is you're clearing the skin from the superficial microbial populations, and that can decrease the sensitivity of the tests that dermatologists can perform in clinic to diagnose your condition and move things along. So first off, if you're experiencing chronic intertriginous issues and are overweight, losing weight would be a great solution for a lot of different issues, especially affecting the area. That'll decrease the friction, it'll likely decrease the secretions over the area, and will make you less prone to developing chronic irritation and other conditions of the groin. Also, keep the area dry if you can. That means pat it dry after showers, and you can use even cornstarch powder to dry the area even more. If you have a sweatiness issue, you may need to use an antiperspirant. Antiperspirants come with a baggage. They can sometimes be irritating. Consult your dermatologist about that if you're in doubt. So moisturization, and that sounds a little weird because we just discussed about drying the area up. Moisturization can help with certain friction-related issues. However, that is a touchy subject. Moisturization can also make certain intertriginous conditions worse, such as jock itch itself, Erythrasma, and possibly some of the irritant-related conditions. So moisturize delicately, choose a proper moisturizer. If you think that your condition is related to friction in any way, physical friction that is, you may need some lubrication over the area. And that would include things like petroleum jelly or my Creamy Carnauba moisturizing balm that can be applied over the area with the least amount of irritation possible. Special attention needs to be paid to the underwear you're wearing. If you're wearing very tight underwear, if the underwear is actually chafing at the groin folds, that's a sign for you to switch up the underwear and wear something more loosely fitting so you're not aggravating your condition by the physical friction that the underwear can create. And then finally, if your condition does not seem to have gotten a message after you've done all these nice things for the area, backed away from irritation, treated the area very gently, maybe even tried a treatment or two, go see your dermatologist to get diagnosed, determine the treatment plan, and follow up in a timely fashion to make sure you're actually getting better. So what should you expect at the dermatologist's office? Well, first of all, it is going to be a conversation first. The dermatologist will ask you about your symptoms, figure out exactly what is happening as far as the factors that could potentially be irritating the area or causing other issues over the area. Then the physical exam. So the dermatologist will evaluate the area visually to see if they can determine what it is that you're suffering from. If they can't on a glance determine what's going on, there's a number of tests that the dermatologist can perform bedside that could give us a clues for what's causing your condition. For fungus, for instance, we can do a test called KOH prep, which can demonstrate the spores or the hyphae, which are different elements of the fungus, microscopic elements under the microscope. Then there are cultures and even biopsies that can help us determine if this is a fungal infection or not. For erythrasma, there's a special test that we do that is called a Wood's lamp exam, which in erythrasma can have the area glow coral red, as you're seeing in the slide right now. And that can really be very surprising and very impressive, and that's an instant diagnosis of the condition, which leaves us with the management, which is pretty straightforward. Bacterial overgrowth and infection can be diagnosed with a culture, and that can take several days to get the results back. Now, as you've noticed, all these tests that I've just mentioned require some microbes to be present on the surface to make the diagnosis, and that's why I recommended not washing the night before your appointment or the day of your appointment to increase the chances of making a diagnosis and giving your dermatologist the best chance of giving you a solution and working with you to make your condition better. As far as irritant, allergic contact, Intertrigo, seborrheic dermatitis, or psoriasis, many of those conditions can be diagnosed visually and treated immediately. However, in certain cases where the dermatologist may be in doubt about what's causing your condition, especially if it's looking a little bit unusual to fit any one of these criteria or categories that we mentioned, they may opt to do a skin biopsy to help further diagnose your condition and get you a bottom line from which you can design the treatment plan and move forward, getting you some relief. If you've enjoyed the content on this video so far, please hit the like and subscribe button, share the contents with the ones you love, spread the information, spread the knowledge, get people some relief from the conditions they're suffering from silently without sharing with anybody, point them in the right direction. Now let's talk about treatments for some of those conditions that we've addressed so far. So jock itch or fungus of the groin, fungal infection of the groin, otherwise known as tinea cruris, is usually treated with antifungal medications. Some of them are topical, and in the more extensive and severe cases, tinea cruris will require systemic antifungal medications that are usually prescription grade, meaning you'll need a prescription from your doctor to treat the condition. The reason for the systemic approach is that the fungus can actually burrow deeper down into the hair follicles and is not reachable by the topical treatment that's applied on the skin. In most cases, a combination is needed because the superficial elements are not reached by the systemic medication very effectively, and the deeper elements are not reached by the topical medication very effectively. So the medications are vicing the skin, treating the problem from the inside and from the outside as well. As far as erythrasma is concerned, erythrasma will usually respond to topical antibiotics that are prescription grade and will go away within a few weeks. Very simple problem to solve. As far as the irritant and allergic contact dermatitis entities, so those entities usually require withholding or withdrawing the offending agents if there's any friction involved. Obviously, mitigating those factors or withdrawing them from the equation would be a great idea to start. With allergic contact Intertrigo, you need to withdraw the offending product or the offending agent so you don't perpetuate your condition by continuous application of the triggering agent. As far as psoriasis is concerned, psoriasis can be treated topically with medications, usually topical steroids and other anti-inflammatory agents. And in more severe cases of psoriasis, treatment can consist of systemic medications. Seborrheic dermatitis usually is treated by topical antifungals and other medications that are anti-inflammatory. In the more severe cases, seborrheic dermatitis may require systemic treatment with either antifungals or other anti-inflammatory medications. As far as candidiasis is concerned, candidiasis will usually respond to anti-yeast medications and will turn around quickly within a few days to a few short weeks. In some severe cases, candidiasis may require systemic antifungal medications as well. And lastly, bacterial overgrowth or bacterial infection over the area will respond to antibiotics. In the more mild cases, especially when it's just overgrowth, that'll respond to topical antibiotics and antibacterials, sometimes in combination, topicals and washes. And in the more severe cases where there's an actual infection with bacteria involved, that'll require systemic antibiotics, again prescribed by your physician. So remember, if your jock itch is not in a hurry to go away and is not turning around in a timely fashion, meaning in a very few short days or a few short weeks, consider backing away from some of the factors that we discussed that could make the area worse. Try gentle approach to the area, and if those approaches do not work, seek help from your board-certified dermatologist. Thank you so much for watching this video. If you got benefit from it, please hit the like and subscribe button. Share it with the people you love. More great content coming your way right from this channel. Thanks for watching, and God bless.